Welcome to the Currents of Public Health webinar, presented by the School of Public Health at Georgia State University. My name is Brian Greer, and I'm the Director of Development for the School of Public Health. The goal of this series is to explore relevant public health topics with members of our community. Today's topic is Systematic Reviews in Public Health, Understanding the Evidence. Our guest is Dr. Terri Piggott, who is a professor at Georgia State University with a joint appointment in the School of Public Health and the College of Education and Human Development. Dr. Piggott was formerly the Associate Provost for Research and Professor of Research Methodology at Loyola University, Chicago. She earned her BA in Psychology at the University of Notre Dame and her PhD in Measurement, Evaluation, and Statistical Analysis at the University of Chicago. Her research focuses on methods for meta-analysis, including power, missing data, and individual participant meta-analysis. Her work has appeared in Review of Educational Research, Research Synthesis Methods, and Educational Researcher. She is the founding chair of the AERA Special Interest Group for Systematic Review and Meta-Analysis. In 2016, she was awarded the Frederick Mosteller Award from the Campbell Collaboration for Distinctive Contributions for Systematic. Today's webinar will be guided by three general questions. What are you doing? Why is it important? And how can we get involved? A quick note, if you have a question at any point during our conversation, please feel free to the Q&A box and we will try our best to answer. So let's begin. Dr. Piggott, welcome to the webinar. Please share with us your presentation on systematic reviews in public health. What is it and why is it so important?
Thank you so much, Brian. So why don't we get right into it? Let's start with a definition of what is a systematic review. So it's important to note that systematic reviews are rigorous sets of rigorous kind of research study, just as we would conduct any kind of research study in public health. And a systematic review uses explicit criteria and transparent processes to identify, assess, and synthesize results of multiple studies to address some central research question while minimizing bias and error. So that's kind of a mouthful, but in essence, what the goal of a systematic review is to identify and assess all the evidence we have about a given research question. Okay, so why are they important? Well, I think we all know that relying on a single study to make sort of policy decisions, it can be problematic. We don't ask one person their opinion and then make a generalization from that. And we do the same thing when we think about a single study. One of the things I think that we're all very good at, and we all get very good at when you're doing a degree in public health, is understanding the flaws of a given single study. A single study can't generalize to all the people, for example, that we care about. But multiple studies can't say on a given intervention, on the effectiveness of a given public health intervention. Those multiple studies can represent broader contexts and participants, and that looking across a set of studies on the same topic or on the effectiveness of an intervention provides us with more information about how, say, a given intervention might behave or how effective it might be in different contexts. So systematic reviews are really important because they can highlight for us what we know and what we don't yet know about any given issue. And so just briefly, I wanted to emphasize the fact that we use rigorous methods in systematic reviews, just as we would use rigorous methods in a randomized controlled trial or any other kind of research study. So we start with a problem, a research question, and then the steps we take are going to look like the kinds of steps we take in any research study. Only what we're doing here is gathering, instead of recruiting people to our study, we're gathering all the evidence, all the studies that have been conducted on a given topic. So the second step is actually searching the literature. And searching the literature turns out to be a significant step in a systematic review, because the studies that get conducted that might be related to a given topic are actually conducted in a number of different disciplines. Public health is a multidisciplinary discipline. And so we have to remember that lots of people are interested in the same questions that we are. So searching the literature turns out to be a significant part of a systematic review and must be done in a comprehensive way. And I don't want to belabor the point, but what I normally tell people is to do when they're doing a systematic review is to actually consult with librarians, because this is not a skill that all of us have. It is actually very difficult to find all the studies on a given topic. And then we go on to sort of screening to find the studies that are relevant to our question. And then the fourth step is to code and extract data from our studies that we're going to use in order to say something about what all the studies are actually finding and to describe those studies. And then finally, and that data we get in step 4, we use in step 5 to analyze what we found across these set of studies. And most of my work in my career has been in that 5th step in developing methods to meta-analyze studies, which is to actually take the quantitative results from studies and to describe, what those are, how they vary across studies. So for example, understanding how effective an intervention might be across a given set of studies. So I thought I would, instead of belaboring sort of all the steps here, talk a little bit about some examples of systematic reviews and the different kinds of questions that people might use systematic reviewing to address. So my first example comes from actually a recent graduate from our Georgia State School of Public Health, Dr. Nai-Hung Lee. And in this, this systematic review is called a scoping review. And a scoping review aims to try to understand what are all the studies that have been conducted on a given topic. They're not talking about sort of the results of them, but just sort of laying out a map or a landscape of the studies that have been conducted. And Dr. Lee took my meta-analysis class when she was a student and was really interested in this idea of, what is the effect of childhood polyvictimization on health outcomes. But it turned out when she was doing her project in my class that the construct of polyvictimization was not being used consistently across studies. And that in these studies, lots of different health outcomes were being identified. So what she decided to do as part of her dissertation was to actually understand who has been studying this. What are the studies that look at the association between childhood polyvictimization and health outcomes, and how are people defining that construct, polyvictimization? Okay, and so that's one example of a systematic review. Along the same lines, another kind of way people use systematic reviews are what's called an evidence and gap map. So this is an example of one looking at water sanitation and hygiene evidence. And this is an actual sort of map of the amount of evidence that we have about given wash interventions and certain outcomes. If you can see this, it's probably hard to see, but each of the rows of this sort of graph here are different water sanitation and hygiene interventions. So the first one is an intervention focusing on supply, so directly providing hardware. And then the columns are different outcomes. And what we see here, what the little dots are showing us is how much research has actually been done. How many studies are actually been conducted in these areas. So for example, in the very upper right box there, it's the number of studies that have been done looking at direct hardware provisions impact on water supply behavior. And so the size of the gray dots are the number of studies that have been conducted, and then the colored dots are something about the quality of those studies, with green being higher quality studies and red being very low quality studies. And this evidence and gap map shows us where we have evidence about given interventions effectiveness on particular outcomes. And again, to do this map, we're using the same steps that I just talked about earlier. So now I want to give you an example of a meta-analysis, where in fact what our goal in a systematic review is to actually estimate something. And in here, and in this particular example, it's to estimate the effectiveness of buprenorphine for people suffering from opioid use disorder, and to understand its effectiveness on quality of life outcomes. And this is another example of a systematic review and meta-analysis conducted by one of our Georgia State graduates, Dr. Olivia Golan, with a number of other students, current students, Elizabeth Perry, Kenesha Fortson, and Dr. Daniel Whitaker. And in this case, Dr. Golan was really interested again in how does buprenorphine for opioid use disorder, how does that impact quality of life? Well, just as a quick note about what Dr. Golan found, we found actually that the studies that have been conducted in this area are actually of very low quality. And so it's very difficult to make, to make a determination of how effective buprenorphine is for improving quality of life, because the study qualities are very low. And then, just to have one more example of systematic reviews is one I'm involved in with some colleagues, where we're trying to estimate the correlation, the association between big 5 personality domains and alcohol use. And so, for example, we want to know, do people who score high on conscientiousness have a different correlation with alcohol use than people who score high in extroversion? And so we did find differences in those associations, but one of the sort of secondary questions for Dr. Liu, who was the key researcher on this in this particular systematic review, was to understand if those correlations hold across different participant groups. And what we found out was that most of the studies on this issue have been conducted on almost entirely white samples. So we know nothing about the relationship between personality domains and alcohol use in any non-white populations. So I thought so these are just a couple of examples of systematic reviews and what they can help us understand about public health. And so I think I'll stop there and see if there are any questions.
Yeah, great. Well, thank you. That is helpful. So I do have my next follow-up question is, so do you have any tips for helping our audience understand research? Or another way of saying that is, what do they need to be looking for to determine if research is of high quality?
Yes. So I want to specifically talk about when you encounter a systematic review that you want to, for example, that's important in your particular area, how do you assess whether it's good? Because like all studies, there are good and bad systematic reviews. And so here are a couple of things that you might want to think about, when you're, when you assess a systematic review in an area of importance to you. So if you remember our steps that we talked about, a key piece is that literature search. And it's if we want to use a systematic review to actually talk about what is in the literature, then our literature search better be thorough and comprehensive. It better use multiple databases and strategies, and also should include unpublished studies. Although this used to be a controversial issue, it turns out that it has been demonstrated over and over again that published studies tend to be biased toward statistically significant and larger results. Okay. A second thing you need to think about was how was this systematic review conducted? Like in a primary study, we want to make sure that all the processes are as unbiased as possible. So when people are in a systematic review, the screening process to use to identify eligible studies should be reported and be as unbiased. The same thing for how data was extracted. And then finally, a big one is are the results of the systematic review actually discussed in the context of the quality of the evidence base? Because our results from a systematic review are only as good as the underlying quality of the studies that were included. So,
Gotcha.
yeah.
So you mentioned they're a controversial area. So I'm curious, are there any controversies with systematic reviews currently or across the field?
Well, if any of you are on Twitter and are following any public health, you probably have heard about the mask review. So, so very recently, Cochrane, the Cochrane Collaboration, which is a group that supports systematic review, has published a systematic review on the effectiveness of masks to prevent transmission of virus, and particularly COVID. And so if you're interested in this, and it really is an interesting controversy, I suggest you look up the article that was written about it in the New York Times. But to sort of get down to the to sort of the key issue here, the authors of the review stated that there didn't seem to be any evidence for the effectiveness of masks for preventing, for example, COVID-19 transmission. But it's a little more complicated than that, because the studies that were included in the review are actually of very low quality. And you can understand that, because it's very difficult to think about doing a randomized controlled trial that might look at the effectiveness of masks during the pandemic. It would be very difficult to randomly assign people to masks and not masks, and then ensure that people who were in the mask condition were always wearing the masks. The people in the not mask condition weren't wearing masks. So you can see that this is a highly, controversial kind of, area to think about, even doing a randomized control trial. But the controversies around it are actually really fascinating. So I suggest you kind of look up that article in the New York Times and follow what has come from that. Yeah.
Gotcha. My next question is a two-parter. So what does the research do once misunderstood information has been released? And then do you have any advice for researchers to help them better disseminate their findings to a broader audience?
So I'm going to kind of go back to this mask example again. So what was also fascinating about this mask example, and that was laid out in the New York Times article, was the sort of controversy around how to interpret the results of that systematic review. And so the authors, it turned out the authors were actually, felt differently than the leadership of the Cochrane collaboration. And so there is some difference in how they think about their results. And so it's hard to know what, so it's very difficult for a researcher. I think you have to be very careful as a researcher to make sure you don't overpromise about what your results actually say. And I think what's challenging about that is that people want a single answer, but most of the time, the conclusions from systematic reviews and even primary studies are much more nuanced than that. And I think on our side, on the researcher side, it's really important to try to be as careful as you can in your conclusions, because once it's out there, it's hard to know what, it's hard to, to put the genie back in the bottle, so to speak. Yeah. So I think I think we all want to change the world. We all want that. We all want, to get that finding, that really changes, how we think about things. But I think as researchers, we have to be very careful about, what our study actually says, and try to be very clear about that. I hope that answered that question.
Yeah. So shifting a little bit, but I think this is a topic we hear a lot, especially in public health. Can you speak to the importance of representation in research and how it affects overall outcomes?
So I think I gave you an example, the example of the systematic review that I helped conduct around the relationship between big five personality domains and alcohol use. And that what we disappointingly found was that we can't say much about non-white populations. And I think in the area of systematic reviews, we see this a lot, that it's important when we're thinking about the results of a systematic review or of any study to understand who it is that has been studied and how representative that sample is to people that we care about or to the general population. And so we see that in many areas of public health, some segments of our population have not been studied systematically, so we don't know much about that. And so I think it's an, we really have to, as researchers, be aware of who is represented, whose voices are there, and whose voices are not there. And though we talk about this more in qualitative research, it's critically also important in quantitative research. So
Gotcha.
yeah.
So drilling down a little bit in sort of your personal experience, do you have any personal examples of ethical dilemmas or hard decisions in regard to your research?
Yeah. I think we've touched on this before. One piece is also, making sure that I'm very careful about the kinds of conclusions that I can make from my research, and to be as specific and also nuanced as possible to understand how well my what do my results really say, and what do they who is represented in those results, and so forth. So I think that is always sort of a something that's always top of my mind when I'm thinking about how do I talk about the research I've done. In systematic reviews, I think there are two areas that are, sort of critical importance in terms of ethics. One has to do with sort of being open and transparent about the methods that I've used. Systematic reviews are highly cited, so I feel like there's a greater responsibility of those of us who work in this area to be very transparent about how we've conducted our systematic review. And so that means being as open as possible, including, having a published protocol, openly publishing our data and our code and so forth, so that people can, reproduce what we've done. And so I think because they carry sort of an over importance in some areas, we need to make sure that they are really done well. And the other, a second piece that comes up, I think, is sort of the idea of, when I think about that sort of that hard decision question, it is also about, what counts as evidence. So how do we make the decision about what studies get included in a systematic review, and what are we counting as, as high quality or low quality evidence for a given question? And so I think that that again, that has to be transparent, but certainly what we include in a systematic review is going to make a big difference into the kinds of conclusions that we come to. Yeah.
Gotcha.
Yeah.
I'm curious if, and this is sort of an audience question here, do you think with the new prevalence of artificial intelligence, could that have an impact on research going forward into the future?
Yeah, I've been thinking about that, and I'm a little worried too. So stepping back from systematic reviews a bit, I am also an editor of a journal, and so I have been seeing some papers being submitted that are coming through the journal pipeline that were probably not written by a person.
Hmm.
And so I think that is going to, so there's going to be an issue with sort of, making sure that the research that we're actually publishing and seeing was written by a person and was actually conducted. So I think there's going to be a lot of issues around that. And so I am worried about how that's going to impact, on a personal level, how that's going to impact my role as a journal editor, but on the level of someone who spends their time, looking at research. I'm worried about, about there being, pieces of research out there that aren't really real. Yeah.
Mm. Gotcha. So, and
Yeah.
that actually, I think, segues well into my final question. What does the future of systematic review, the systematic review process look like, and are there any threats? So we just talked
Yeah.
about that one. Are there any more going
Yeah.
into the future?
Um, Well, I mean, on the positive side of sort of these technologies, these machine learning technologies and AI technologies, on the positive side, they have been really helpful in streamlining some of the processes of a systematic review. So people are using AI technologies and machine learning to make the screening process for systematic review more streamlined. And to maybe help us code things and also to search the literature. So on the positive side, there's been that's been really important. On the on other threats, I think are always there now there's a proliferation of systematic reviews, and trying to understand which ones are most relevant to what we're interested in is important. And again, I can't emphasize enough the importance of of people who do systematic reviews being very responsible in how they talk about what the results actually mean, since they have such a oversized sort of influence on policy.
Hmm.
Yeah.
Gotcha.
Yeah.
Well, thank you for your time. This has been very informative, and I appreciate you sharing all this information with us. And I think you've been able to take something that sometimes seems overwhelming and make it so attainable or able for us all to understand. So I really appreciate it.
Well, thanks,
And I want to
Brian.
thank, yeah, I want to thank all of you for attending the Currents of Public Health webinar today. I think we've had a great conversation, and hopefully you all will be able to take something with you from it. In closing, the School of Public Health at Georgia State University is one of the most diverse schools of public health in the nation, offering a Bachelor of Science in Public Health, a graduate certificate, a Master of Public Health degree in 6 concentrations, a PhD degree in 4 public health areas of knowledge, and a Doctor of Public Health degree. The faculty and students conduct research on the complex public health challenges facing cities across the globe. Our work is often carried out in partnership with communities, the residents, and community-based organizations committed to health equity. If you'd like more information about our programs or how to support the work of the school and our students, please visit publichealth.gsu.edu. Thank you again to Dr. Piggott, and thank you all for attending. Please join us for our next webinar on Thursday, April 13th at 12 p.m. featuring Dr. Ike Okinson, who is a professor of epidemiology and biostatistics in the Department of Population Health Sciences at the School of Public Health. Thank you all again for attending, and we'll see you next time.